Awesome. Hey guys, it's so nice to meet you. My name is Sharon Sable, and I am a parent of a 3-year-old, 3.5-year-old. Oh my goodness, with a boy with Down syndrome. His name is Aiden, and he's very much the light of our lives. And he is equally as amazing as he is challenging. So we are as we moved to Tennessee, which was about a year and a half ago, we got plugged in with Gigi's Playhouse, and it was one of the reasons why we moved down here was for the ample resources in the community for families with Down syndrome and for kids with Down syndrome also. And so being plugged in with Gigi's Playhouse has been amazing. So if you are a new family and wherever you are across the country, I highly suggest seeing if you might be able to get plugged into your local Gigi's. We know there's not always a location right next to you, but if you are able to make a trip a little bit further, it's definitely worth it to just be face to face with some families who are just in the same boat as you are, with little ones the same age as you, as your kiddo. So we started this program. We kind of was like this little brainchild that came about over the COVID time, when we thought, wow, there's this really big gap where we are all forced to be quarantined at home, and we can't really be in person and getting these resources and spending time together as families. And so we've had a few of these sessions that have just blossomed out of that mindset. And so we've had occupational therapy come on, we've had play therapy, and let's see, Dr. Molly Hood, pediatrician, came on, and I think there's another one I'm forgetting. But either way, I hope that this is always aimed to give you as much information as you need to just get started on your journey towards getting some of those questions answered. And also know that you are definitely not alone. There's a huge community here of families and also of professionals in the area to support you and love you along the way and to be next to you. And so if you are feeling like you're kind of on an island on your own, please know that we're here for you. And so you could start by joining. You could friend me on Facebook if you want. I'm totally cool with that. My name is Sharon Sable. But also there's an Extra Connection Facebook page for Gigi's Playhouse that you can jump into and hopefully get some of these answers to some of these things that you might be kind of questioning about with your little kiddo with Down syndrome. So without further ado, we have two amazing speech and language and feeding therapists that have donated their time to be with us today, and we are so thankful. We have Laura Sanchez and Linda something. I'm sure you have a last. You're quite amazing. Linda Tyson, I've actually heard lovely things about you from some of the other members in our community who have kids with Down syndrome. I know Laura's last name because Laura is Aiden's feeding therapist. And so, full disclaimer. So, so we have been just, for lack of a better word, blessed by all of the amazing things that she has done for our family and for Aiden. And so we're excited to have them share with you. Please feel free to drop questions into the chat box. I will be monitoring them. Carly will be monitoring them. And if we can squeeze them in, we certainly will. And it's all you guys. Take it away.
Okay, thank you, Sharon. We're so excited to be here tonight. So like Sharon said, I am a speech language pathologist specializing in feeding. And I just want to take a minute and just talk about High Hopes Development Center, which is where Linda and I both work. And so we are a pediatric therapy clinic, and we have physical therapy, occupational therapy, speech and feeding that we offer here. And we also have an adjoining preschool. And so it's an all-inclusive preschool. So we have 40%, our ratios in our classrooms are 40% developmentally delayed kiddos and then 60% typically developing kiddos. So it's a really neat model that I feel like we have here, and we're able to see outpatients as well as kids next door in the preschool. So we feel really lucky to have this model here. So now let Linda introduce herself.
My name is Linda Tyson. I'm also a speech language pathologist, and I specialize in feeding. We just quickly wanted to do a little disclaimer. We're going to be showing a lot of tools, therapy tools, things that we use in the clinic all day long. And we're also going to be talking about some techniques. We do not get any compensation. This is full disclosure. We don't get any sort of kickback or anything from any of the companies. So these are just tools that we like and we use all the time. So we just wanted to make sure we threw that out there. And then we also, just so y'all know, we tried to look through we got questions this morning, and I think there were over 30 questions, and we're going to try to work those into the presentation as we can. But please feel free to, if we don't hit one, make sure that you shoot it our way, and we'll do our best. And then I think we're ready to get going. So when we talk about feeding disorders, or even just children that are having difficulty with feeding, we always consider 5 different areas. And what I need you to know is that this isn't a hierarchy. Oral motor skills aren't number 1 and family dynamics number 5. This is just a list of things that as a feeding therapist we keep in our mind to keep us organized, and so that we can navigate with a child where they're having difficulties, but also what they're doing well. It's always really important to remember what skills we have and what we're doing well, so that we can then add upon that and figure out what we need to work and to change a little bit. So please don't think about this as a hierarchy. It's just the 5 areas that we consider. So oral motor skills is number 1 on this list, and that is specifically the motor skills with your lips and your cheek, with your tongue, and with your jaw. But it also goes into positioning, and you're going to hear us talk a little bit about positioning and what positions are important. But what we need to do to coordinate those fine motor skills. Feeding is a fine motor activity, and we need to remember that a lot of times we need to get gross motor skills, or those big motor skills, before we can get to the fine motor skills of eating and speech. We do use the same muscles for eating that we use for speech, and so sometimes as we're working on these skills from a feeding perspective, it can also help with speech. The second thing that we look at are sensory skills. So if you think about it, sensory is how things look, how things smell, how things taste, how things sound, how things touch, how it feels to your skin. So we're going to talk a lot about sensory skills. And then we're going to talk briefly about medical considerations. So what could be going on with your child medically that could be impacting their feeding? And we'll talk about that. We're also going to talk about behavior skills, because infants and toddlers have behaviors. Sometimes there are behaviors that we want to, and sometimes there are behaviors that we want to change. But we need to decide if it's really a behavior or if we have something else going on. So we're going to talk about that just real briefly. And then we're also going to talk about family dynamics. So just keeping in mind that who's feeding your child can really impact their progress. So those are the 5 areas that we're going to consider. And we're going to start with oral motor skills. And this, we're going to try to keep it brief, but remember that, it's also a little bit tricky because 0 to 5 or 0 to 3 hits a lot of oral motor skills, and we literally could talk about this. I have an oral motor skill presentation that is an hour. It's at least an hour just talking about oral motor skills. So we're going to hit some of the highlights. And again, these are just starting points. If your child is truly struggling, I'm going to encourage you, as would Sharon, I'm sure, and Laura, to find a feeding therapist. And don't feel badly about asking that feeding therapist what their skill set is, what kind of techniques they use, and find one that fits with your skill set, with your mindset. And that's really, really important, because this is a journey that we feel we need to walk with you. And so we're going to empower you to find somebody that fits well with you and with your child. So oral motor skills, lips and cheeks. As they're infants, they're born into physiological flexion, right? Our little infants come out and their hands are up here by their mouth, their shoulders are really high, and we're in this great little position, and infants were made to eat. All they have to do is drop their jaw, and their cheeks provide enough pressure and suction against a nipple, whether it's a breast or whether it's a bottle, to extract fluid from the bottle. And all they have to do is kind of do like this little bitty drop, and they're able to eat efficiently. As we get older, those skills have to get more refined, and we have to be able to use our lips separate from our jaw and separate from our tongue. So some things that you can work on to work on getting those lips and cheeks nice and strong, you can work on blowing kisses. And we start all of these things very, very young with our kiddos. 6 to 8 months, we start really working on oral motor skills away from bottle and breastfeeding. So we can work on blowing kisses. Just getting those lips together at first is enough. And I think later in the list, there's lip pops. So a lip pop would just be getting the lips together and giving a little pop. A kiss, we actually get the lips, we get a good pucker. So we've got to use more muscles in order to do that big kiss. You can also just work on when we take a bite and we go, That's going to work on that active lip closure that we need for the spoon. Something that's really fun that we like to do, we call it no hands, but you can put, I've got a veggie straw here. You can put it between the lips, no hand, and just have them work on holding a piece. You can hold it this way. We use veggie straws all day long, by the way, because you can do all kinds of great things with veggie straws and you don't even have to eat them. And then they can just go in the trash. So the other thing you can do is blow them. It's a great whistle. And again, you're working on those active lips. So veggie straws are great. You can also get whistles. Whistles are fantastic to use for that. Harmonicas, anything where they have to blow. Bubbles are great as well. So another thing that you can work on for those lips is going between like ooh, ee. So you're going between like a lip pucker, and we call that lip retraction. And that's really important for skills that we need for eating. You can also, it's really important, sorry, I'm trying to find my spoon. When you're working on spoon feeding, to make sure that we don't scrape off. So when you put a spoon in a child's mouth, you want to keep it nice and flat, and you want to put it straight in, and you want them to close down with their lips and pull off the spoon. The first stage to a swallow is close our lips. And then once we close our lips and our lips pull off, the tongue actually goes backwards like it's supposed to, and then they'll swallow the food. So if you've got a child that's losing a lot out the front, that could be what's going on. If we're not getting those lips at least partially closed onto the spoon, if we go and we scrape off the food off the spoon with their teeth or their gums, then likely it gets stuck in their palate. And we don't know when it's going to fall down onto their tongue. And if it does fall down onto their tongue, a lot of times they go and they give us a nice gag because they weren't expecting it. And then they'll just push it out forward, and you'll lose everything forward. So we want to make sure that when we're using a spoon, that they actually get those lips closed down onto the spoon. So then with the tongue has to develop lots of really, really tricky skills. Again, we're talking about very specific fine motor skills as we talk about the tongue. For infants, the tongue actually, all it does is rock forward and backwards. And then as they get more sophisticated, they start to get what we call tongue rolling. So it actually starts to go this way, and it starts to go this way to collect the food. And then we get what's called tongue-jaw dissociation. So the tongue actually starts moving separately from the jaw. So we can actually move the tongue. And that's what we need to control chewables. So a lot of the questions that we saw had to do with how do I get my child to go from purees to chewables? And so we're going to talk about this in this process, but they need to develop these tongue skills. So they need to develop that tongue to go from forward to backwards, to this tongue rolling, to then tongue-jaw dissociation where they can really control it. And we're going to talk a little bit more about that as we go.
And Linda, when we talk about kids with Down syndrome also, we're probably talking about kids with lower tone, muscle tone, and that must affect the way that the tongue moves as well. Is that right?
That is correct. And one other thing, I think it was a question that came in this morning, was about how do I get my child's tongue in their mouth? One thing that's specific to children with Down syndrome, is that their oral cavity is small. It's not that their tongues are large, it's that their oral and nasal cavities are often very, very small. And so it makes the tongue look larger, and it also makes the tongue sometimes protrude forward. And that there's nothing that we can do about that. That's a structural thing, and we need to work on those skills with the tongue, and we need to refine those skills with the tongue. But in order for them to be able to get their tongue in their oral cavity, it may take up too much space, and they may not actually be able to keep an airway. So that's likely they're pushing that tongue forward so that they have an airway in the back so they can breathe. And children are always going to pick breathing over eating. So that's really important. And you've got that muscle tone issue too. So that tongue is going to be a little bit more flaccid, and it's not going to move quite as specifically. Some activities that we like to do to work on the tongue skills, though, if you take something sticky, it can be yogurt, it can be pudding, it can be peanut butter.
Do you mean a where?
No, it's okay. I think we're okay. And you can just put a little bit on that top lip. And what we want them to do is try to lick it off. So we're going to put it up there, and we're going to see if they can lick it off. You can put it on the corners of the mouth, and that's going to encourage getting that side-to-side movement that we need when we start chewing chewables. So we're going to go this way, we're going to put a little over here, we're going to get them to go over there so that that tongue starts to move. The fun thing about the tongue is that, think about whenever you have something stuck in your teeth, your tongue tries to go get it, right? And it won't leave it alone until you get it free. The tongue is like, wait, what is that? What is that? What is that? So that's why we're going to put things in different positions. The tongue is a very curious feature, and it wants to go find it. So we're going to work on that. We're going to work on licking, just getting the tongue out and actually licking a lollipop instead of putting the lollipop in and close it. Well, you can do that if you're working on lips, but we don't want them to just put the sucker in and lick it. We want that tongue protrusion. So we can work on licking. Also work on tongue clicking that tongue, and then blowing raspberries. So with these little ones, I know we had a lot of questions that came in about little ones. Fun things that babies do, they blow different kinds of raspberries. There are 3 different kinds. The first one is called bilabial raspberries, and that's using 2 lips. So with both our lips. That's important for P, B, M, and W. So it's important for speech, but it's also important for feeding. Then we have a second raspberry called a linguolabial raspberry, which is your tongue and your lip. Right? We do this with babies. These are fun things, and you want to have fun with your baby, and we want to see you doing these things with your baby. But that's important. We need that tongue protrusion and that tongue out. It's important for a lot of sounds. So we've got T, D, N, L, and S. And then they have a raspberry in the back of their throat, which sounds kind of like a that's important for K and G. So just keep those in mind as you're playing with your baby. Those are really important for speech, but also for feeding. And then for chewing and jaw strength, some things that you can do. If you have like a fruit or a vegetable, a piece of string cheese, a piece of fruit leather, and they have teeth, you can work on just putting teeth marks into that. And they think it's really fun to actually like get teeth marks in, and we'll take a bite and they'll take a bite, and we show each other teeth marks. And you can also play tug of war. I was going to bring a piece of licorice, but just where they bite it, and we always bite in the back. We'll talk about that a little bit more in a minute. But we bite in the back. Yeah, we can do it with licorice. So we always place in the back, whether they have teeth or not. And then you're actually going to give a pull. And then we're going to tell her open. And we always want to make sure that we do both sides. So I'm going to give her a good little pull there. And I'm going to say, good job. And then we can even have her bite in the front and give a little pull there. And that's how we can work on some of that chewing and jaw strength. So we're going to go ahead and go to the next slide.
Okay, so next we want to think about our sensory skills that come into play with feeding. So we love this quote right there at the top of that page, you got to get messy to learn. And so that I feel like is our motto with our kids. Like we want our kids to get messy. So if you think about those pictures that you see of kids that are covered literally from head to toe in spaghetti, it is in their hair, it's on their hands, it's all over their face. That is exactly the experience that we want kids to have with food. So And I know it's hard. I have 2 kids, and it's hard to sit there and watch them sling food everywhere. But they have to experience food with all of their senses. So like Linda mentioned before, we think about it's not just taste that kids are experiencing with their food. So it's the way that it feels, it's the way that it smells, it's the way that it sounds. It is all of those things. So we want to, encourage kids to do that with their food. So one thing too that we want to make sure that we're really encouraging this play with the food. And so we want to ignore any kind of behaviors that are kind of coming out, like if we're seeing a lot of refusals, a lot of no, throwing away, throwing off the tray. We want to ignore as much of that as we can and really focus on anything positive that they're doing with food. So, if they're touching it, or even if it's, hey, they're tolerating it on their tray today, like we want to be really excited about that. And really, give them some positive feedback on that. And so one thing that that Linda and I are both trained in it's called the Steps to Eating, and it was developed by a child psychologist, Kay Toomey, and it's a very systematic approach to actually eating food. So it's about approximately 30 different steps that kids can go through before they actually will eat food. And I think I brought a little copy of it somewhere. It's just, so I don't know if you guys can see it. Okay, yeah, it's going to be too small, but you can see that there's lots and lots of different steps. So eating is all the way at the top. And so it's good to just think about how can we get kids to engage with food if they're giving us these refusal behaviors, or we're seeing signs that they're, the gagging, the, throwing it, turning their head away, things like that. How can we get them to engage and interact with food? And so we want to think about doing things, where they're just touching it with their hands, bringing it up to their nose to smell. Even we do like a lot of finger painting with, pudding and yogurt, things that really just kind of engages all of their senses. And so then kind of the first of those steps is just being able to tolerate it. And with some kids, that's where we're starting, is just, hey, we're going to bring the food and we're going to, be in the same room with it and be okay. And then gradually work up to touching it, stirring it with a spoon, smelling it, and then eventually tasting it. And even when we get to taste, some of our kids, just need a tiny nibble. I think we talk about this a lot. Like we just want little bites. If you get a big piece in your mouth, that likely is going to be way too much for your mouth to handle. So we talk about doing baby nibbles, mouse bites, anything like that, just to kind of get it in your mouth. And we're definitely always okay for kids to spit it back out too. It's just going to help them. The goal is obviously to get it in their mouth and chew it and swallow it, but sometimes they just need those little baby steps in between. So another thing to think about is just, so we are kind of looking at foods like, are there certain textures, food that kids are gravitating to, like maybe they only are eating crunchy things, and so trying to build off those things. So say we have a kiddo that comes in and they are, loving veggie straws and Ritz crackers and, chips, but maybe we don't have any proteins. So then we're going to think, okay, what can we build off? They're likely going to go for crunchy food. So maybe we want to do some crispy bacon or some crispy pepperoni and start kind of expanding it that way while still working on tolerating some of the other textures and consistencies. So even another thing, some kids gravitate to food based on color. Once again, it's one of our senses is visual. So things that maybe they are into red foods, and so they'll eat watermelon and strawberries. And so we might want to pull in something similar like raspberries, and then suddenly that food seems safe because these other foods that are red, they're good and I like those and they feel okay in my mouth. So this might be as well.
Real quickly, just to talk about temperature, children's mouths are much more sensitive than adults, because think about the number of times that you've burnt your mouth on food. right? Or coffee. We all take a sip, and that's how we test the temperature, by the way. We take a sip first. we don't stick our finger in it. We take a sip, and then we're like, oh, that was way too hot, and we burnt our mouth. Because we've burnt our mouth so much, we've actually developed a little bit of scar tissue on the roof of our mouth and on our tongue. So we are not nearly as sensitive to temperature as infants and little toddlers who hopefully have not burned their mouths as much as we have. So that's why children, because I often get asked, why did they like it room temperature? And it's because to them, like if it's warm, that feels hot. And if it's cool, that feels like freezing cold. So a lot of kiddos like ice cream, for example. My parents will go, they won't eat ice cream unless I let it sit out. And it's sitting out. It's not that they want it soupy. It's that they don't want it that cold because that temperature change is just too drastic. So always keep that in the back of your mind, that they don't need food. They're quite content for their food to all be the same, kind of that just room temperature. And then we have a couple, just real quickly, grapes. And if you cut a hot dog in a circle so that it looks like this, that's a choking hazard. So please avoid that. I don't want you to avoid grapes altogether. I just don't want you to cut them into circles. So if you do grapes, quarter them. And if you do hot dogs, do the same thing. Quarter it and give them small bites. So I'm not saying we're not saying don't do those foods. We're just saying make sure that you cut those because those are a choking hazard. And those are actually that kind of quarter size is what can get lodged in their airway. And that's what so we try to avoid choking foods. I think we can go on to the next slide. So medical considerations, there are a lot for children with Down syndrome. This is a very, very short list, and we're well aware of that. So we know that lots of children have cardiac issues, lots of children have G-tubes. But these are just things that if you have a child that's doing pretty well with eating, but you can't quite figure out what's going on, these are things that I want you to pop in the back of your head that may be going on. So reflux is a huge one. And we want to make sure that if they're having reflux, if they're struggling with reflux, that it's being medically managed, preferably by a GI doctor, and if not, by your pediatrician. Sometimes that means sometimes there are other things that they use. But if your child is showing signs of, especially if they're an infant or a small toddler, if they're showing signs of reflux, please make sure that you get that under control, because they may be turning away from food and refusing food because they're uncomfortable. The only thing that will override a hunger pain is pain. So what happens to an infant or a child is they get hunger pain and they're like, oh, I'm starving. And they suck down. And I'm sure some of you have these kiddos. They'll suck down like an ounce or two, and then they go, and they stop. They stop because they turn their hunger pain switch off. And they're like, if I keep eating, now my pain is going to kick up, and I don't want to do that. Infants and toddlers are really, really smart, and they have a lot of internally, they read their cues very, very well. And so we need to help them with that. So if you're seeing anything with reflux, make sure that you're getting that managed. A very common problem with our children with Down syndrome is constipation. And that goes along, I know Sharon mentioned low tone earlier, and that goes right along with some of the lower tone. Once our kids are up on their feet and they're walking, that helps with constipation a lot because movement helps with constipation. But make sure, just like reflux, make sure that you're getting constipation managed. And that means a bowel movement for us every day or every other day. I am really not okay with children going longer than 3 days without a bowel movement. And it should be soft, and they shouldn't be straining. I don't want to see rabbit pellets, like little balls. That typically can indicate dehydration. We want that to be nice and smooth and kind of soft, and we don't want them straining. It can cause all kinds of other problems. So again, with constipation, if you don't have a feeding therapist, make sure that your pediatrician or GI doc is right on top of the constipation. It can also really throw off their hunger cues. So they don't really understand if they're constipated and backed up. It's hard to you feel full, you don't feel hungry. And so it really messes with those hunger-satiety cycles. Food allergies is a huge one. Obviously, with our children with Down syndrome, we need to be careful with celiac disease. So just make sure that you're watching for anything that may look like a food allergy. Again, you're going to consult with your pediatrician, potentially a pediatric allergist. And a big one for us is nasal congestion and drainage. Again, as we talked about earlier, children with Down syndrome a lot of times have very, very small nasal passages, and their oral cavity is really, really small. So because it's so teeny tiny, anytime they get a little bit of mucus, they get stopped up very quickly. And think about when your nose is stopped up, you can't taste food, and it just doesn't, it's just not quite right in your mouth. So if we're chronically congested, food's not going to taste right. Also, if we can't breathe through our nose, we're obligated to breathe through our mouth. And when we breathe through our mouth and our mouth is hanging open, more likely it's going to also contribute to our tongue hanging forward. Gravity is not our friend. And so if we're here, right, because we can't breathe through our nose, so we're trying to breathe through our mouth, and then we have a little bitty small space back here in the back. So our tongue's going to slide forward to create a bigger airway in the back. So our tongue slides forward. And then if we're looking down at the table, because I have something down here at the table, our tongue's already out a little bit. Our tongue's going to fall further out because of gravity. So just keep those things in mind and manage nasal congestion and drainage as best as you can. I know it's really, really difficult, but I just want you to, again, if you're seeing your child who used to eat a food and all of a sudden one day they start refusing it, that could be what's contributing to it. We want to make sure that we don't always look at it as, well, they used to eat this, why aren't they eating it today? There's a lot of reasons that they might not be eating it.
And I just wanted to add on really quickly, you know, after hearing all of these things, I remember even through the years with Aiden, just it feeling really overwhelming. Like, okay, he has a problem now. What do I do? What do I do? I need to fix it. I need to fix it. And I would just maybe offer a little encouragement to any parents or grandparents that are listening to, instead of actively trying to fix everything, of course you need to go to your doctors and things like that. But I think for you emotionally and mentally, just meeting your child where they're at and being like, they're struggling with this right now. It's not always going to be like this, but now I understand why it's so hard for them. And then you can kind of feel that empathy for them, and you can know like this is really, really tough for them, and be there alongside with them on their journey, and just know that it's not always forever, but that these could be some of the reasons why, and that they'll get there. And it's just time to, you know, just kind of stick with it and take a deep breath.
Exactly.
And
We can go to the next.
we had a couple questions, and they're related to these medical considerations. So I'll go ahead and ask you them if that's okay.
Carly, I'm a little worried about time because we're already at 7:35.
Okay.
So I know, but I'm just a little worried because we have a lot of info to try to get through.
Okay, yes. Maybe I'll save these questions from our chat, and I can send these to you afterwards. And if you guys have time this week, we can get those out.
Okay, or we'll see if we can answer them at the end. I just want to kind of make sure we get through our slides and just be cognizant of everybody's time at the same time.
Perfect.
Okay, this is a big one for me because we have to look at a child and figure out, are they showing us a behavior, or is it a developmental stage or level that they're at, or are they having a sensory response? I would say more often than not, they're at a developmental stage or level, or it's a sensory response, then it's actually a true behavior. But when a child takes a food and they throw it at you, what we think of is, stop throwing your food at me. I don't want you throwing your food. But what happens from a grasp, it's a grasp reflex. Children, and this is where your OTs can really help you, but they learn what's called grasp and release. And I know there were a lot of questions about this in the chat earlier. So what happens is they grasp a food and it goes over here to the side, and they drop it and it drops on the floor, and you're like, stop dropping your food off the tray. But developmentally, we have to remember that that's where they're at. They're at grasp and release. They're not at grasp and bring it to our mouth. So what we need to do in that case is, and again, so it's not a behavior. They're not picking it up and throwing it on the floor. That's just developmentally where they're at and what they can do. So we need to pick that food up, and you're going to guide typically from the arm, because if you grab somebody's hand, what do? They go, they're like, let go of my hand. Why are you holding? And now we've dropped the food again. So a lot of times if we scoop up the food and then we guide from the arm, so they've scooped it up, we're going to guide from here and we're going to bring it to their mouth. and then they're going to mouth on it. They're going to be like, oh, well, that was kind of cool. And then we can have them put it down on their tray. We can let them release, but we're going to release it down here onto the tray, and then we're going to let them pick up something else. And as soon as they start to go this sideways, you're going to grab that arm again, and you're going to bring it back, and you're going to bring it up to their mouth. So remember, and this happens a lot with our children with Down syndrome, because they're developing those fine motor skills with their hand, just like they're developing the fine motor skills with their mouth, and they need to refine that. So keep that in mind. Are they actually just doing this because developmentally that's where they're at? Are they picking it up? Now, this is where we get into, is it a sensory response? Are they picking it up and they go, ooh, that was the most disgusting thing ever, and they drop it? And again, it looks like a behavior, but it's not a behavior at all. It's a sensory response. They were like, that was the most disgusting thing I just put in my hand, and I need it gone. And so we need to be real careful with that sensory response that we often get, and we'll get it with the hands sometimes. We'll also get it with the mouth. So they'll put a food in their mouth, and they go, wait a minute, that was not the texture I was expecting, or the flavor, or the, whatever. It was the wrong temperature, it was the wrong whatever, and they go, and they spit it out. That's not a behavior, that's a sensory response. And so I just wanted to make sure we put this in here so that everybody is looking at it and we're saying, hang on a second, most of the time, our children aren't being ugly. Most of the time, that's where they are, either from a developmental perspective or it's a sensory response, and they just need that food gone. Trust me. So I always tell people to think about a food that you don't like, and for me, it's beets. There is nothing about a beet that I like. I don't like the way it looks. I don't like the way it smells. I don't like the way it tastes. And honestly, if you made me put it in my mouth, I would want to spit it out and be really ugly too. So think about that as your kids do these things. I want you to think about that, because it may just be that for them, think about that food. A lot of people will say oysters, or because they're slimy, or broccoli because of the texture. Think about it as you're looking at the foods that you're presenting, and we need to present it lots and lots and lots of times so they get that experience that Laura was talking about. So a lot of times you'll have to introduce a food 15, 20 times before a child even is going to be willing to put it in their mouth. So the name of the game with feeding is patience. Kindness. We want to be supportive of our children, and we just want to give them lots of good experiences, and have it be a positive thing for them to come to the table. We can go to the next slide.
And that actually kind of goes into what we're going to talk about next, just the family dynamic. And I think this is a piece that a lot of times is easy to overlook, especially if there's been a change in your child's feeding behaviors. You may forget that something has changed within your family dynamic. So if, say, for instance, grandma is usually there feeding your child for lunch, and then something changes and maybe your child is going to daycare, or someone else is feeding. All of these things can come into play on whether a child is willing to eat or not. And so also another thing too is to think about siblings. And I know sometimes this is hard to control, but if we have maybe an older or a younger child at the table that is, maybe not modeling the best eating behaviors, that's refusing a lot or making some negative comments, that certainly can come into play too, is whether a child is going to be motivated to try. So once again, just really, really trying to encourage those positive, behaviors at mealtime. And even sometimes it is, I think I talk a lot about this with my families, like it's not only the people who are at the table, but even thinking about the setting that you're at. So like, say that a child is always at one place in the table, and then we change where the child is sitting at the table. Suddenly they went from looking at this wall and now they're looking over here. Well, sometimes that can be a trigger, even that, hey, I used to always look at this picture and now I'm looking at the refrigerator over here, so I'm not going to eat because I'm used to looking at that over there. So just trying to kind of piece some of these other things together, and just kind of look at the whole picture of what's going on.
Children like routine and repetition, and they really don't necessarily like change, as a lot of us don't. I feel that group as well. So keep that in mind too, that they're trying to hang on to, I know what this is going to do. It's predictable, and that's what I want to do. So that's why some of your kids that are don't want to branch out and do new things. It's because that's a new experience, and that's just, they just aren't, or they don't want to do that. We can go to the next slide. There we go.
Okay, so we will just briefly touch on this. So this is kind of how we look at kids, just kind of see how many kids that, how many foods that kids would have within each of these groups. So we want kids to have a balanced, wide variety in their diet. So ideally we would have 10 proteins, 10 starches, and 10 fruits and vegetables. So it's really, kids are considered a problem feeder if they have less than 20 foods. So I'm like,
so 10 different proteins. Examples would be, can we eat things like chicken, yogurt, cheese? Are there any meats? Can we do any beans? So we look at all of, there are a lot of things that are considered protein. Most of our kids are really, really good at starches, and then fruits and veggies are the tough ones. And a lot of times they'll do fruits first because they're sweet, and vegetables are more bitter. If you've got a child though that's eating a lot of fruit, that's a great thing, and keep going, because they'll get to vegetables that bitter flavor, and they've got, once they get a little bit older, they tolerate it a little bit better. I have not yet met a pediatrician or a dietitian who said, don't put cheese on their broccoli if that's the way you can get them to eat broccoli. So don't be afraid to make the vegetables yummy. If we will eat carrots with butter and brown sugar on them, that's great. We're eating carrots. What you can do is gradually back off on the butter, and you can gradually back off on the brown sugar, but they're eating a carrot. So we're gonna celebrate the win, even if that carrot is doused in ranch.
I was gonna say, we do lots of dips.
We do lots of dips around here.
Yes.
I mean, we could be just, that carrot could just be dripping with ranch or whatever.
Yes.
But they're eating a carrot. So go ahead and use those dips. Use those flavor. We call them flavor maskers. And then just as they start to eat it, then make it a little less, make it a little less, make it a little less. And that's how you're going to get your kids eating a wider variety of fruits and vegetables.
And also keep in mind, it's 10 fruits and vegetables together. So it's not 10 vegetables. I think our general rule of thumb is we love for kids to have 4. Sometimes we're happy if they have 2 vegetables. So we understand it's a process, and they will get there. So, okay, I think we can head on to the next slide. Okay, portion size. I think this is a biggie. Parents, I think all adults, we're so used to, especially in America, huge portion sizes. And so making sure that we have realistic expectations of what our kids need in their diet and what they will accept. So kind of the general rule of thumb is going to be that 1 tablespoon per year of age. So if we're thinking about a 2-year-old, it would be 2 tablespoons of a protein, 2 tablespoons of a starch, and 2 tablespoons of a fruit or veggie. So yes, all in all, not a lot, not a lot at all. And then also, so we talk a ton about keeping kids on schedules with eating. So we do not want grazing throughout the day. And I know it's hard if you feel like your kid is not eating a lot, and you're like, hey, we'll take a few bites here, a few bites here, a few bites here. All the child is doing is just turning off. They're like, hey, I'll eat a few bites. I'm going to turn off that hunger signal, and then I'll keep going. And they're never really learning to get that good stretch on their tummy that will happen at a meal if they can sit down and have a meal or a snack. So we want to think for toddlers, we're looking for 3 meals and 2 snacks a day, and about 2.5 to 3 hours between eating. So it kind of stretches throughout the day. And we don't want kids sitting at the table for an hour. You know, we want to limit meals to 20 to 30 minutes, and then kind of pack it up and move on, because we need that time between our next snack or meal. A biggie for us is to always make sure that your child is positioned in a good supportive seating. So we want kind of hips at 90-degree angle. We want some foot support if we can get it, so kids aren't dangling in air. So if you think about, if you are constantly trying to keep yourself upright, the last thing you're going to be able to do is do this motor movement of getting food into your mouth, doing all the fine motor part of chewing and swallowing and all of that. So we want to make sure the kids have good back support, head support. We also want to make sure that our head is at a neutral position. If we have head up like this, where our neck is hyperextended, this opens up our airway. Our lips and our tongue are retracted, and it's just going to make eating not very safe and be a lot harder. So just all things to kind of take into consideration there. We always encourage modeling eating. Not only can it help develop oral motor skills if kids actually see what you're saying when you're like, hey, let's chew with our side teeth. I always tell parents, like, throw manners out the window. I want you to eat with your mouth open, show your child exactly what we want them to do with your tongue. You know, when we're talking about moving it over to your dinosaur teeth, your side teeth, I want you to show them the movement. And it also can help our sensory kiddos. Like if we are working on licking or smelling, you know, we actually want to show them what we're talking about when we're doing this. Let's see, even encouraging them to, you know, feed you. I do a lot of double spoons, so where I have a spoon and they have a spoon, and they're taking a bite and then I'm offering a bite to them. Sometimes that can kind of speed up the process. It's fun for them. They still feel in control because they have a spoon as well. And then a lot of times we'll do side placement of the spoon, because if you are coming straight on and the spoon's coming right at you, sometimes, yeah, your initial reactions can be like, hey, get this on my face. So if you just present from the side, that can be really helpful, and kids sometimes will accept that a lot easier. So another thing, yeah, encouraging any kind of participation in mealtime prep. Not only, I know this is more for 0 to 3, so we're not going to be doing a lot of cooking as your child gets older. You know, we do like a lot of gardening activities and things to kind of get them motivated and interested in food. But even I recommend doing family style dinners when you can, so the child actually has to pick up the bowl or push the bowl or engage and interact with the food in some capacity, even if they don't want it on their plate or they can't. You know, they're not that far up the steps to eating, but at least it's, you know, tolerating being near it. They get those smells, and just have a good positive experience around that food. So we can go on to are you good with that? Okay. Okay, so let's see. So yes, biggie. please do not force feed your child. And I know it's really hard sometimes, but that can just set them 10 steps backwards. And they have got to learn to trust food, and they also have to learn to trust who is feeding them. So it's got to be, and I know this is a process too, so don't feel like you can't come out of that hole, because you certainly can. But we want to be respectful of their boundaries, and we just want to, I think we've worked on this, like just keeping things fun and happy, and as much as you can, to kind of turn that around. We want to avoid frequent face wiping, cleaning of the hands during meals. We want them, like we were talking about with the sensory experience, we want them fully immersed as much as they can be. And one thing too that I think can be helpful is trying to use a paper towel instead of the baby wipes, just so we don't leave that kind of baby wipe residue on their lips, and it just kind of tastes gross. But to even start with the hands at the end of meals, to start with the hands and wipe those first. And then sometimes it's less aversive to go to the face after that. It just kind of gives kids a little bit of time to be like, okay, I'm ready, this is coming. And I do some counting too, just so kids know that it's done. I'll do 1, 2, 3, all done. And I think that that's really helpful. So once again, just giving praise and attention for those things that we want to see, and trying to ignore those behaviors that we don't.
So yeah, so with that, positive statements and not asking questions, we try really hard, and it doesn't. We do it too. So I will 100% hold up my hand and say, oh, I do it too. But we try to, instead of saying don't throw, as soon as you see that hand back, say put it down. And you can do that firmly, and you can do it with a gesture. And then what happens is they're like, oh, wait, hang on a second. And then if they put the food down, then it can turn into a positive thing, and you can say, that was great listening. I love how you put that down. You listened to mommy or daddy or grandma, and you put it on your tray. So we always want to make sure, so don't throw is a big one. If they grab your hair, by the way, because that tends to be a big thing, you're close to them when they're eating and they tend to get your hair, let go. Because what do we say? They grab our hair and we say, don't pull. And then they hear the word pull and they pull it. And then we're like, I told you not to pull my hair. So we don't want them to pull. We want to say, let go. And that can go too, if they're going through a pinching or a scratching phase, hands off or let go is really, really helpful. So think about what you're saying. Don't run. We want to say walk. Think about if you're using don't with things, think about how you could say it in the positive. So they hear the word that you want them to be doing. So if they put food in their mouth, for example, they've got a bite in their mouth, we're telling them, close your lips and swallow. We're not saying don't spit it out. We say very quickly, close your lips, and I want to see you swallow. Or do something with the food, whatever stage we're at. But that's really, really helpful because our reaction is to say, no, don't spit that out. So we want to tell them to close your lips and swallow. And we do it just very calmly. And oftentimes I'm giving them that cue, by the way, to bring that top lip down or that bottom lip up. So I'm saying close, and then we're going to swallow. I think we can go to the next one. These go right along with what we were just talking about, and I think these are pretty self-explanatory, so I'm not going to go through them because I'm hoping that we can have a little bit of, we've got a couple more slides and then some questions. But instead of just saying, take another bite, eat another bite, these are lots of things that you can ask a parent or you can ask your child to do so that it's not always the same thing. So we like to give choices. Do you want a veggie straw or do you want your cracker? And then that way the child feels that they have a little bit of control. Again, we all like control. We like routine repetition. We like to control things. And then if they get to pick it, they're like, oh, I got to pick what I wanted. And you can give them two choices of things that you want them to eat. So it can be a carrot or an orange. But they always feel like they have a little bit more control when they get to make a choice. So choices are really, really huge so that they feel like they have a little bit of control. I'm going to go ahead.
Yeah, okay. And not the yes, no questions. And I 100%, I try not to do this, but I think we all do it. I'm trying not to ask a lot of yes, no questions. You don't want to say, are you going to eat that veggie straw? Because as soon as they say no, then you're kind of stuck. So that's where the choices come in. Doing things like, are you going to give me a big crunch or a little crunch on that veggie straw, just to kind of get them to buy in, and like Linda said, so they kind of feel like they have control over that. So, okay, that was it.
I think we can go to the next one. So these are ideas. I'm going to go through these really quickly because I know we have people that were listening for little ones. And people were asking, when do I start purees? Do we do baby-led weaning, or do we do, like, how do we do this? I love baby-led weaning, except I think children need to learn the skill of eating from a spoon, because they need to get that lip closure. We were talking about those oral motor skills at the very beginning, and they need to get that spoon. They need to get that lip closure onto the spoon. They need those active lips, and they don't get it if we just go straight on to baby-led weaning. So there's two things that I want you to do before you go to baby-led weaning. One is we need to learn how to eat from a spoon from an oral motor perspective, so we get that lip closure. And the second is, I feel like it's much easier to control food allergies if we do it very systematically. We need to be very systematic with foods when we're offering to littles to make sure that we can catch a food allergy, because it's a bummer if you've offered a child 4 new foods and all of a sudden their face breaks out, or they start vomiting, they have really bad diarrhea. Then you have to take all 4 of those foods out and start over. Instead, if you start with one food and give it for 3 days and they don't have a reaction, you can pretty much know that they're safe with that food, and then you can move to the next food. So it takes a little bit on the front end, but it's much, much easier to catch a food allergy that way. I love to start with green vegetables first. This was another question that somebody asked. I hope they're on. I like to start with greens, so green beans and peas. And then, so we start with those vegetables that are a little more bitter that they may not like as much first. And then we go to the orange vegetables. So these are all pureed, by the way. These are pureed vegetables. You can either puree them yourself or you can buy them in the jars. Sweet potato, squash, carrots, and pumpkin are the primary orange ones. and then you can go on to fruits. I do want to make one quick warning about fruits. They're very acidic, and if you've got a kiddo that's a refluxer, it can kick up reflux. So you need to be a little bit careful with those acidic fruits. We talked about that. And then we're going to start with those meltables. So that would be like a Gerber puff. We're going to start with a puff or a mum cracker, something that melts in their mouth is really, really easy. And that around 8 or 9 months is when you're going to introduce that. And you're not going to introduce it to the front of the mouth. You're actually going to introduce it over here on the gums, because again, if they take a bite off, they don't have that tongue skill to move it over here to chew. The skill that they have is, if you put a food over here, I can go ah la 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 la. I can munch, and then once it's munched, then they can use that tongue to roll. We need to get that tongue rolling going, and then they can swallow it. So we're not going to put it here. We're going to put it way back here. So another question was about teeth. They don't have a lot of teeth. Their gums at 8 to 9 months are hard enough and strong enough to break down some of those early chewables. So don't worry about if they don't have teeth. They can start chewing things long before they have all of their teeth. And then you can also offer a open cup and straw between 8 and 10 months, depending on their oromotor skills. I want to check the last slide really fast. Okay, so these are just, I'm going to go through, we're going to go through these super, super fast. These are things that we like to use, and then we'll open it up to questions. So take and toss. These spoons and forks are our absolute favorite. They're cheap. You can get them at all, like Target, Walmart. You can get them at the grocery store, but it's a really nice flat spoon. And this is the spoon that I actually use starting with them at the beginning. I don't use infant spoons at all. I use this nice little plastic spoon. This is called a duo spoon.
I don't know if you can see, it's actually textured on each side. So it's great for kids to start learning how to self-feed or get little taste. It's rubbery, so it's not going to jab in and hurt a child. So we use these a lot for kids that they can control it and engage and interact with it that way. So. And
then these are called chewy tubes. There's a red one and a green one. The green one, I don't think you can probably see it, but it's also got a lot of bumps on it. You can do lots of things with chewy tubes. We were talking about you can put it in and you can bite and we can pull. You also, if you put it in this way, they can blow it like a whistle. It'll actually whistle. It's not a loud whistle, but if you've got one, you can whistle with that. So we use chewy tubes a lot.
Neck brush is next. These are all kind of like the chewy tube. You can place it right where you need it to be to work on chewing, biting. I roll food a lot in this, so we just get taste, tiny little taste. So it's great for sensory kiddos as well.
Yeah, so if they like to, if they're putting those in their mouth, we always show them. So we'll show them, I dipped it in here, I dipped it in the yogurt, I dipped it in crumbs. We don't want to try to be sneaky at all. That goes back to what Laura was saying about trusting us. We want them to trust us. We don't want to try to be sneaky, because if we're sneaky, then they're like, oh, wait, no, I don't know what to expect. So we want to keep that. This is a gum massager, by the way. These are really hard to see a little bit. But this one you can actually run along their gums. And it actually, once they get teeth, you can start cleaning them pretty quickly.
Okay, so a divided plate is great. That's going to be hard, but it can. So we use these a lot. It kind of keeps kids their food obviously separated. It kind of gives kids some boundaries, but also we can put some like learning foods over on one side. Maybe they're not quite ready to eat it, but they eat these foods over here. So that they're just great little plates to have. Our Honey Bear straw cup. This is great. I use this all the time to teach kids how to drink from a straw. It's the only straw cup out there that you can control, other than like a juice box or something. So we start working on kids having their close their lips around it, and then we can gently squeeze, and they start learning is, oh, hey, when my lips close, I'm going to actually get a little bit of liquid or something in there. So,
somebody just asked a question about a Z-Vibe. Here's a Z-Vibe. So if you don't know what a Z-Vibe is, if you turn it on, it vibrates. The blue part vibrates gently, and it's nice and quiet. It's a quiet vibration. I do like Z-Vibes. I'm a little bit careful for our kids that are sensory, because sometimes that vibration is a little bit too much for them and it's scary. But I'll bring it out just like this first, and there's lots of different tips that this is a long yellow bumpy one, but there's lots of different tips that you can put on here. So sometimes you can, you don't have to have the Z-Vibe on, and you can be working on some of those bite and pull activities that we were talking about earlier.
Okay, like where are we at?
Yeah, so real fast, a lot of people don't know these exist. This is a juice box holder. And so you know what do your kids do? They grab a juice box and they go squirt, and the juice goes flying everywhere, and you're like, that makes me crazy. Yeah, so there's juice box holders. They cost like $2 on Amazon. They're great. So you just put it in here, and I love it because it has 2 handles. And then you can just put the straw in here. But wait, it's a multi-purpose tool. I figured this out not too long ago. A pouch fits in here too. So I love that you can put a pouch in here, because the kids do the same thing with the pouches, right? They squeeze it and it goes flying everywhere. So get yourself a little bitty one. If you use this is the big size juice box, but if you have the shorter size juice box, they fit in this way, and it won't move in the handles. So anyway, I think every mom should have. I don't care how old your child is. Every mom needs to have 5 of these.
They're amazing.
They're great. So I think that's most.
Yeah.
Oh, I think let's skip that.
Okay.
Let's go to questions.
So we have a large amount of questions. In addition to the couple that have been shown here in the chat box, of course, there have been like a huge amount that got sent in earlier. And so couple of things that I just want to mention to all of our participants that are here now is that we see you, we hear you, and we know that you have, there's been some questions about G-tube feeding, some questions about bottle feeding and about breastfeeding, and there's this whole multitude of things. So what I think our plan is Laura and Linda and I will just kind of have an email, and Carly will have an email going, and we'll see if we can tackle any of those questions that way, and maybe send something out afterwards. But just for the sake of time, we'll tackle the ones in the chat box for right now, and just kind of see where that takes us, because we don't want to go and spend a huge amount of time here and monopolize anybody's time. So just wanted to start up here at the top. Somebody had a question about how can they manage all of these different things that are going on with their child's preschool. How can they manage all of the things that we need to do to help our kiddo with Down syndrome be successful with eating, but when they're in preschool, they don't have their eyes on their child. How do they talk to their daycare providers and work with that?
So we a lot of times will actually talk. I would encourage, if you have a feeding therapist, I would highly encourage you to let your feeding therapist talk to your daycare provider, the teacher, the assistant in the room, whoever's feeding your child, because yes, we definitely need everybody on the same page with that. So, okay, so
I think it's a good idea to, if you need to, you can also schedule an appointment with either the teacher or the director and explain some of the things that your child may have different needs at the table, and again, why they have those needs. So we talked about some of those. Is it a behavior? Is it a sensory response? Or is it a developmental stage? Because a lot of people that aren't in this world don't know, they view it as behavior. And so we need to make sure that they understand that it's not.
Absolutely. Yeah, definitely teamwork and everybody being on the same page there is great. Somebody has a question about their daughter's in cancer treatment, and is not really able to have any desire to eat anything right now. Do you have any suggestions for her?
So I think my biggest suggestion with that is keep them going with oral motor skills. So keep them doing any kind of interest that you can get with that blowing, with that sucking, with blowing kisses, with moving the tongue around in the mouth, because as long as we're keeping those skills going, and even if it's just pleasurable tastes, anything that she likes to lick, or she can just lick it and then be done. So it just needs to be positive and pleasurable. But I would stay with some of those oral motor tools that we talked about, and just let her explore and have fun and keep those skills up while you're waiting for the cancer treatment.
My heart goes out to you so much, Mama or Grandma or Aunt or whoever. Just stay strong. which is like such a ridiculous thing to say, right? We could go all day with all the things that we could say, but I just want to say my heart goes out to you. Another question is, why would food come out of the nose when a kiddo is eating? Would it have anything to do with reflux?
So I saw that one come by and I almost hit it. So that's called it's actually nasopharyngeal backflow. What happens is as we go to swallow, the food, instead of going down the esophagus, it goes and it hits the back of the palate, and it actually goes up. And then it comes out the nose. So it has to do with the palate, which is the soft palate in the back, not actually going all the way against the back of the mouth and closing off. It doesn't come all the way back, and because the space is open back here, the food is allowed to come out the nose. I think that particular child may have a cleft lip and palate, and if they do, that's why, because that palate is open, and there's nothing keeping the food between the mouth and the nose. It doesn't. If the reflux, so it can have to do with reflux as well. If the reflux is forceful enough, it can come out the mouth and nose.
Mm-hmm. It's really interesting. And I think everybody has this question on their mind is, how do I get my 3-year-old to try new foods? Like, what do I do? Please help, SOS, I am done. I'm so frustrated. Like, that's how I feel.
You want to think about those steps to eating. So we're not going to automatically you guys have tried this and it hasn't worked, right? So you're not going to plop it on the plate and expect them to pick it up and eat it. So you want to think about, how are we going to engage them and get them motivated to try this food? So whether it's you spend the first 10 times just touching the food, or building a little tower with the food, or breaking it in two, listening to it. And then you kind of want to move up those steps, think about, maybe next we're going to smell it, then we might lick it, and just kind of build up from there. So, and we always recommend just take, 1 or 2 foods at a time, and try to pick foods that are similar to if you can kind of look at your kids, the types of foods that they're eating, and you're like, hey, once again, we were talking about color, texture, try to pick foods. Say they're eating apples, well, we may want to try pears next, because they're similar in look, similar in texture, taste somewhat. So, trying to build off things that they already have to expand their variety of foods. So,
absolutely. Yep. Yeah. Okay. My month-old uses his tongue on the bottom of a straw, rolls it around this, like that, to suck that liquid out. And how do I encourage him to use his lips?
So there's a difference between functional skills and perfect skills. A lot of the times we're looking for function, and if they're curling their tongue around the straw but they're functional with it, a lot of times we leave it alone. If we've got active lip closure onto a spoon, and we can use our lips to close down onto, like I said, onto the spoon, and we can get our lips closed for the sounds P, V, M, and W. If that's the case, we don't worry about a tongue that's curling around a straw. It may not look perfect, but it's functional and it's working.
Mm-hmm. And then it sounds like you go back to those playthings with the practicing the lip closure.
Yeah. And then one thing that came up real quickly, somebody asked, their child's dribbling liquid out of their mouth. So if you've got a kiddo that's drinking thin liquids, water or juice, and they're dribbling it out of their mouth, it's likely because it's really thin and it goes really fast and it's hard to control. So you may want to thicken it up a little bit and give them something that's a little bit thicker. So if you've got water, you might want to put a little bit of apple juice or apple sauce in it and make it a little bit thicker. Or you can use a smoothie. You can do a strawberry drinkable yogurt, or you could do a strawberry banana smoothie, and give them something thicker to actually drink, because it's going to be that thicker consistency is easier to control. It goes a little bit slower. So we go a lot of times from that thick consistency, and then we thin it out.
Gradually go back
down to a thin liquid.
Absolutely. You guys have been absolutely phenomenal. We just really appreciate your time here. And I just want to be respectful of everybody's time. So what we're going to do is we're going to close out the session for now, and we'll touch base about some of the questions on this Google form, because I know a lot of people have questions. And we just want to thank you so much for volunteering your time. And to all the parents that are out there that are like, oh my gosh, that was a lot of information. I just want you to know that, like, as a parent of a 3-year-old with Down syndrome, I have heard all of these things over the course of 3 years. And so it has been, if you could just take like 1 or 2 things from this evening, give it a try, and this will be posted on YouTube. Like, you can come back to it all the time. And the fact that you showed it here and you care so much, like, you are a phenomenal parent. I just want to remind you of that, and that this is amazing that you guys were able to be here. So thank you so much. Please, if you are not a part of the Facebook group, the Extra Connection, that is where this replay is going. The link is going to be posted. You can always search for Gigi's Playhouse Nashville on YouTube, and you can see it'll be posted there. But if you want a notification on Facebook when it gets posted, please check that out. We'd love to have you be notified of our future Extra Connections, because we already have a couple in the works and we're so excited. And I think this is my cue to stop talking. So thank you.
Thank you guys so much. We really appreciate it.
Yes, thank you for having us.
Thanks. Bye.
Thank you, everyone.